My name is Leslie Klein, and I'm a master's student at Liberty University. The purpose of this presentation is to propose further research of addiction counselors and how their work environment contributes to burnout. After examining burnout among addiction counselors, Geertes, Butts, Lamberson, and Lassiter asserted that further research is necessary to examine the different environments that addiction counselors work in, such as outpatient facilities, inpatient facilities, and private practices. Counselors working in the addiction field are exposed to many stressors, including working with the criminal justice system, helping homelessness, preventing relapse, and dealing with mental illnesses. Not only is the function of the job stressful, but the repercussions are also unfulfilling. Counselors experience low wages, difficulty managing workloads, lack of prestige, and limited resources. All of these are factors that lead to burnout among counselors and eventually remove them from a place in which they can help others. A study by Batal in 2019 examined a large outpatient facility in which the counselors named workplace demands as the biggest contributor to their stress. Another study by Roger Voladarga produced results indicating that worksite factors were important in reducing burnout. Carrie also studied the difference in rural versus urban environment and determined counselors working in rural areas were more prone to burnout than those in urban settings. This led to the question of what effect does workplace setting have on counselor burnout rate? Based on the information provided, I hypothesize that individuals working in large inpatient facilities are more prone to burnout than those in private practices or outpatient facilities. The null hypothesis states that there is no significant difference in the counselor burnout rate among individuals working in large inpatient facilities to those working in outpatient facilities or private practices. The target population of this study is addiction counselors in West Virginia. From this population, we will test a sample of counselors from various work environments. To do so, we will employ non-probability voluntary sampling by inviting the individuals to participate in the study. We will pull the population from the National Association for Addiction Professional Counselors and contact individuals via email. The email will generate a questionnaire to determine the eligibility of the participant so that we can verify they are actively working with clients and determine what setting they are in. Once we receive feedback from the questionnaire, we will be able to divide participants into 3 categories based off workplace: inpatient treatment, outpatient treatment, and private practice. Once we have briefed potential participants and weeded out those who do not fit the study, we will use an online survey designed to gather data. Counselor Burnout Inventory is the instrument that will be used for this study. The CBI is given to counselors as a way to determine burnout levels. It was specifically developed to assess burnout in counselors as it relates to the environment in which they work, making it the perfect instrument for this study. It assesses 5 dimensions: exhaustion, negative work environment, devaluing client, incompetence, and deterioration of personal life. These dimensions are measured by a 20-item inventory using a 5-point Likert scale. To analyze the data, a linear multiple regression using SPSS will be utilized. We will divide the survey answers into the 3 different setting groups. Once the scores are calculated, we will use a one-tailed multiple sample t-test to determine if burnout rate is greater among the different settings. The results of the test will then be related to the hypothesis to determine if the rate of burnout for those working in inpatient facilities is significantly higher than those working in private practices or outpatient facilities. Thank you for listening to my proposal. I'll leave you with a word from Ecclesiastes chapter 4. 2 are better than 1, because they have good return for their labor. For if they fall, the one will lift up his fellow. But woe to him that is alone when he falls and has no one to lift him up. As counselors, it may be seen that we have all the answers, but at times the question is, how do we help ourselves? By helping one another and working toward counselor well-being, We are not only helping a fellow counselor, but a generation of lost souls looking to us for guidance.